Good evening from the sanctuary at First United Methodist Church in Gastonia. I'm Dr. Gary Schenk, and I'm here to discuss a little bit about why we should get vaccinated for the COVID-19 virus. I am part of the task force for reopening at First Methodist, and we certainly want to educate everyone on what we're doing and thinking about. But at this point, I'd like to just talk about the vaccine a little bit, answer some questions that have been sent in to the church for me to answer. And should there be any other questions, certainly we'll give an opportunity for that later to be sent in. So first of all, why should you vaccinate yourself against COVID-19? Number one, I think we all want to get back to normal. I'd love to see all these seats in the church filled with my friends and fellow church members. The second reason is you certainly want to prevent individual disease in yourself and protect family members and friends. We also want to get back to normal activities, both economic and social. So I think getting back to normal is probably the best reason to vaccinate. Gaston County has had a mild improvement over the last 3 weeks in the cases of coronavirus. Hospitalizations have been slightly less. But we still have a testing rate that's over 10%, and we really need to get that testing positivity rate down below 5% before we'll feel comfortable about opening back up to any normal activities. I've had several patients of mine talk to me about why they did not want to get vaccinated, and I'm not so sure that they're good reasons, but I'll give you answers to those questions. The first reason that people give me is they think the vaccine came out too soon and hasn't been studied enough. Well, first of all, the FDA goes through rigorous evaluation of any medication or vaccine that comes out before it is put out to market. This vaccine was actually studied with the same way they do other medications. However, FDA approved it for emergency use simply because of the seriousness of the pandemic and the seriousness of the coronavirus illness. They do three things when they do studies. First of all, they look at safety. Secondly, they look at the effectiveness of the vaccine. And third, they look at the dosage of the vaccine. And they did all that with these vaccines, particularly the Moderna and the Pfizer vaccines, and they're doing that now with the Johnson & Johnson vaccine. But all of those things were proven to be safe and effective, and the dosing with 2 shots for those 2 vaccines seems to be sound medically. The second reason that people say that they don't want to take the vaccine is because they think there's governmental control. Well, first of all, these are vaccines that are made by private companies. These companies certainly want to help the public as well as make a good product that goes forward, and they are really not beholden to the government or anybody else's control in making these vaccines. Certainly our local and state governments do have some say-so in how the vaccine is distributed, but certainly not in the manufacture of the vaccine. So I think it's a safe vaccine from that regard. The third question I've gotten from patients is there a chip being placed in my arm when I get the vaccine? And that is totally false. You would have to have a very large needle to put it in anybody's arm to have a chip, so don't be worried about that. And the fourth thing, and probably the one valid concern, is the risk of side effects. There are some people who do react adversely to vaccines and should consider whether or not they get this vaccine. I'll talk later a little bit about the different side effects that people get with both vaccines, as they're very similar. But you've got to remember, the risk of the vaccine versus the risk of having coronavirus and dying or having serious problems with the virus are much more serious than any potential side effects you might have. Remember, there's always a risk-benefit ratio in anything we do, whether we risk getting the virus or we risk taking the vaccine and having potential side effects. Let me talk about the vaccines a little bit. The Moderna vaccine is a little bit different from the Pfizer vaccine in that it can be stored at normal refrigerator or freezer temperatures. The Pfizer vaccine has to be kept at a very low temperature of minus 94 degrees Fahrenheit. And in both of the studies, they found that 95% of people who took both vaccines did not get the coronavirus illness after that vaccine. In the group of people who did not get the vaccines in both cases, approximately 11% of patients got the illness. They had about 185 in the placebo group get the vaccine, and it may not be at quite 11%, but those are the number of cases of people who got it. There were 0 cases in the Moderna study where people in the vaccine group got serious illness, and only 11 people got the illness at all. The Pfizer vaccine had similar numbers, where 95% of people did not get the coronavirus illness, and they had similar placebo group numbers also. So anybody who didn't receive the vaccine in the study groups had a higher risk of getting coronavirus, and that's what you wanted to see. But there was a 95% improvement in the people who got the vaccine over actually contracting the virus. The side effects in both studies were very similar. The main one was pain at the injection site, fatigue, headache, muscle pain, joint pain, chills, nausea and vomiting, swelling, and fever. Now, the muscle pain was in approximately 85% of patients who received the vaccine, and then all of those other side effects were at decreasing quantities of numbers of people. There was one serious event in the vaccine group that required hospitalization, but that was out of 15,000 patients in the Moderna study. And the Pfizer numbers look very similar. Now, both of these vaccines are what they call RNA vaccines. That may not be familiar to a lot of people, but what they do is they take the RNA proteins, the actual protein from the virus, and they make a vaccine that attacks that protein as soon as your body recognizes it. So the virus protein that you get when you're exposed would be immediately attacked in your body by your system, by the antibodies, and that will attack the protein, thus the virus, so it can't reproduce in your body and make you ill. So both of the Pfizer and the Moderna work like that. Those RNA are not ever going into your DNA. It never crosses into your DNA. It doesn't change any of your genetic makeup. It just goes against the virus and does not get embedded anywhere in your system. I've had that question from patients before. I've had a couple questions about the J&J vaccine, and Johnson & Johnson is working on a vaccine that has not gotten emergency approval like the Pfizer and Moderna vaccines. The J&J vaccine actually is not looking at whether it prevents the disease. It just looks at whether it prevents the severity of the disease. And it has prevented the severe disease in 85% of patients, and it's prevented moderate disease in 66% of patients. So you get one shot with the J&J, but it makes it so that 85% of people don't get serious illness to keep them out of the hospital and hopefully prevent death. But again, that's only 85%. There's still, with that vaccine, 15% of people who may get severe disease. So I don't think that vaccine is ready. I also don't think that vaccine is the best choice for people in America. I think we'll have plenty of availability when the supply catches up to demand, and everybody will be able to receive one of the RNA vaccines from Pfizer or Moderna. Now, I've had other questions about whether the mutated strains will respond to these vaccines, and we're not sure. We do think that some of the strains actually are controlled by the vaccines, but we're not sure about the African variant and the South American variant. The initial one in Great Britain, we think the vaccine works for. That will be studied in the future, and we may all need a third vaccine as time goes on to cover some of the mutant strains that we're seeing. Now, mutation is a common thing among viruses, so don't think this is a unique event just to the SARS-CoV-19 virus. All viruses tend to mutate over time. So we knew this would probably be a problem in the future. The flu vaccine, it mutates every year also, so we're very familiar in the vaccine world about viruses mutating. Now, remember, there is no live virus in any of the vaccines. So they're not injecting any virus that is intact into your body. It's just the proteins of the virus. The other thing about the J&J virus, and this is more scientific than anything, is the J&J virus actually is a harmless virus that actually produces the proteins of the COVID-19 virus. So they inject a virus into the body that makes the protein that the body would recognize and fight the COVID-19 virus if it gets to your body. That's a little bit complicated, but it's a little bit different. It's called a virus vector vaccine. The safety of these vaccines are pretty good. They did a study of 4 million people who received the vaccines, and that was both the Moderna and the Pfizer. And out of the 4 million vaccines, there were only 10 severe cases. And what I mean by severe are people who have anaphylactic reactions, meaning trouble breathing, chest pain, shortness of breath, and needed to be hospitalized or treated for a severe reaction. They all occurred within the first 15 minutes of the vaccine. So if you wait around at the vaccine site for 15 to 30 minutes, the severe reaction would happen then, and the people there would be available to take care of any complications. So 10 cases out of 4 million. That's a very low number. So I think severe side effects are pretty rare. Now, we compiled some questions about the vaccine, and I'm just going to go through some of the questions and give my answers to those. The first one was does the virus protect us against the illness, or does it lessen the severity of the illness? In truth, it probably does both things. The J&J virus probably doesn't protect as much as the Pfizer and Moderna, but the Pfizer and Moderna studies did not look to see if it would lessen the disease. They studied just if it would protect you against the disease. So those vaccines will keep you actually from getting sick from the virus at all. Another question was, when is it safe to visit with family and parents, particularly when everyone has been vaccinated? So the short answer to this is 2 weeks after the vaccines, we're pretty sure that your immune system has done exactly what it needs to do, and it creates the antibodies to fight the virus in case you get exposed. So 2 weeks would be a good answer. However, it was never studied, and will be studied ongoing, whether people can be exposed to the virus after being vaccinated, and can you spread the virus in that situation to someone else? And we're not sure about that at this point. My guess is that if you can't get sick with the illness, that you're not going to be able to spread enough viral particles to other people to spread the disease. And that's the goal with all vaccines, is to prevent not only the illness, but also the spread of the disease. So I think within 2 weeks of getting the second vaccine, and either one is fine, Moderna or Pfizer, that you'd be safe to visit with family and parents. The flip side of that is, if you've had coronavirus as an illness, your immunity is probably there for at least 3 to 6 months and may last up to a year or even longer. The studies are ongoing with the people who are in the Moderna and Pfizer studies to see when some of that immunity may wear off. They're having antibody levels drawn, but also watching for cases of the illness in people who have been vaccinated. So there will be more information probably in the fall as to how long the vaccine will last. Now, what does the vaccine mean to public activity? And I assume that question means when will we be able to go out to football games and concerts with other people, or go to restaurants and not have to wear a mask? I'm not quite sure when that's going to happen, but I would feel safe when 50 to 80%, and I prefer closer to 80%, but between 50 and 80% of our country has either had the illness or been vaccinated. When that occurs, you'll see less pockets of infection, and hospitals will not be as full, and then we'll be able to relax our use of masks and our social distancing. I don't think that's going to happen till the end of this year, because I think too many people are thinking about not getting the vaccine or waiting to get it later to see if it's safe or not, and to see if some of the mutant strains will be covered. But I want everybody to remember going out and getting vaccinated is the best way for us to return back to normal activity. So when 50% of our population is vaccinated or has had the disease, and that's approximately 160 million people, we'll probably see some lessening of the disease. Our test numbers will come down, and we'll be able to do more with others in public. Now, what about follow-up of the vaccinated volunteers? They are following up all of the volunteers on a regular basis, drawing blood to check their antibody levels, and also seeing how many of them get sick. So there will be continued follow-up with those. Now, after you get the vaccine, what precautions are you supposed to take? Right now, we need to continue wearing masks. We need to continue social distancing. We need to continue to not gather unless all people have been vaccinated or have had the disease. Now, the problem with that is that you don't always socialize with people who you know very well and what their status is. So for that reason, we need to continue to mask and continue to stay socially distanced in public. Next question is, when you get the vaccine, can you get COVID and pass it on? Well, 95% of people who take the Moderna and Pfizer vaccine should not get the illness, so they definitely won't pass it on. But we're not sure if people can get exposed to the virus and pass it to somebody else. It would have to be a really close contact and a very rare situation for somebody to be adequately vaccinated and pass the disease on. So probably not, but again, we don't know. This virus is very unique, and it does some things we don't quite understand sometimes. Why do we need two vaccines? That's the first part of this question. The two Moderna and Pfizer vaccines studied 1 and 2 shots, and people did not develop the same immunity with 1 shot as they did with 2. So we wanted to get definitely a better vaccine response. So 2 vaccines work so much better than 1 in both of those vaccines. And why will we need a 3rd shot if we have mutations? And the answer to that is probably yes. If the mutations are severe enough to cause illness, and if the first vaccines do not work against the mutations, then we will definitely need to get a 3rd vaccine as it is developed. If we can keep the number of cases down, there will probably be fewer mutations. The more chance that this virus has to spread and mutate in people, the more chance we'll have for mutations. So if we can nip this in the bud quicker, we'll see less problems with it long term. We'll probably know the answer whether we'll need a 3rd shot or not next fall. So I think next fall and the first of the year, we'll probably have some good guidelines as to whether we need a different vaccine altogether or whether we just need a 3rd shot of our current vaccines. Johnson & Johnson vaccine, why is it 1 shot versus 2? Johnson & Johnson studied their vaccine with just 1 shot. It also has not been approved by the FDA like the Pfizer and Moderna vaccines have been approved in emergency status, and I'll explain that in a second. But Johnson & Johnson studied it very differently from Moderna and Pfizer and was not looking for prevention of disease. They were just trying to prevent moderate and severe disease and see what their vaccine did. And in some countries, that's going to be adequate to use, but probably not here. Which vaccine is the best one to get? I think the Pfizer or Moderna, just because it prevents the disease and doesn't just keep you from getting moderate or severe disease. Because if you get moderate or severe disease, you are probably still going to spread the disease to other people. So that would be the best thing there. What about Tylenol? Why and why not use Tylenol? It's recommended that before you get your vaccine, either one, on the first shot or the second shot, to take Tylenol a couple hours before the vaccine, and to continue taking it if you have symptoms: sore arm, fever, achiness, muscle aches. So definitely taking Tylenol is fine. You should also drink lots of fluids, and that'll help you from getting dehydrated. I would make sure before you got either vaccine that you eat and drink well the day before, and that may make it so that you don't have as many side effects if you're better hydrated for those vaccines. A couple other questions came in a little later. What if you're unable to take the second vaccine within your permissible time limit? Well, the studies were done at a 3-week interval with Pfizer and a 4-week interval with Moderna. They did not study anybody who waited 8 weeks or 6 weeks or 3 months. But each time you get the vaccine, your immune response would probably increase. So it may not be as effective if you take it later, but you still should go ahead and get it as soon as you possibly can, getting the second dose. What about pregnancy and women who are breastfeeding? We did not study those situations, that patient group, so you probably should speak to your physician if you're pregnant or breastfeeding. And I think as time goes on, we're going to find that vaccinating pregnant women and breastfeeding women is going to be better than those women actually contracting the disease. So that may be a recommendation later, but those have to be studied before they can make that official recommendation. And the FDA will have to approve that also. Speaking of FDA approval, emergency approval of the Moderna and Pfizer vaccines were done so that we could get this pandemic under control. Emergency designation means that it does not have full approval of the FDA, but later these vaccines should get full approval. I doubt they'll keep them on emergency approval forever. And that'll make it easier for anybody to get the vaccine. States will loosen it up, but that probably will come either later this year or first of 2022. We talked about the range of side effects that people would get and how to manage the side effects at home, basically taking Tylenol, drinking lots of fluids, making sure you stay well hydrated is the best thing you can do in order to combat those side effects. How long should we continue to socially distance and wear a mask following the vaccine? Definitely 2 weeks later, but you should also continue to wear masks in public because we don't know how long the effect of the vaccine is going to work, number one, and number two, if you get exposed, if you can transmit that to someone else. We're still not sure about those. And what about traveling by plane after receiving the vaccine doses? Presumably, you're more safe if you have had the vaccine and are exposed to the virus, and if it's the Pfizer and Moderna vaccine, which are the only two you can get now, you have a 95% chance of the disease being prevented if you become exposed to it. However, we don't know if that immunity lasts for any longer than 3 to 6 months. Hopefully it will last a year or longer. What would be the conditions of resuming group gatherings, particularly coming back to church? It's been proposed that church gatherings could occur if everyone who comes is vaccinated. We would have to obviously trust that everybody be on the honor system as to being vaccinated, or check your vaccine card at the door. I'm not so sure that's the easiest thing to do, but I think when 50 to 80% of our population has been vaccinated, that would be a very good time to begin group gatherings again and questioning people about their vaccine status, although in some situations might be uncomfortable, may be the wisest thing to do. Would it be safe to enroll your children in summer camps or summer gatherings with groups of children? Children seem to not get the illness as severe as older people, but they are definitely carriers of the virus and can carry it back to the family. I think by summer, if everybody in the family, particularly anyone over the age of 65, has been vaccinated, it's probably safe for the kids to go. But we must also remember that there are some people younger who do get serious illness and die from coronavirus. So pay attention to how things are being done, how the vaccination status is by the time your kids go to summer camps or gatherings. The later in the summer you do it, the better off you're going to be, because more people will hopefully have been vaccinated against coronavirus. If someone has an allergy to soy, is it safe for them to take the vaccine? There should not be any soy. There is not any soy product in either vaccine, so that should be safe for people to take. It's also been a question whether if people are allergic to eggs, can you take the vaccine? These two vaccines do not have egg product, nor are they incubated in in the environment of eggs. So you'd be safe to get the vaccine if you have soy or even egg allergy. The last question is, if someone volunteers at a food pantry, would they be considered eligible to receive the vaccine as an essential frontline worker? My guess is they would. Most vaccines, you have to answer a group of questions in order to get an appointment. So wherever you are, answer the questions as honestly as possible and see if your category puts you in the category as frontline worker. And hopefully you can get your vaccine as soon as possible. That's all the questions I have. A couple final comments. Number one is the delay in getting vaccines is probably a supply issue. The supply issue is probably a manufacturing issue altogether, and Pfizer and Moderna are both, I'm sure, working hard to get it out and get as many vaccines into the arms of people as possible. That's the first thing. So be patient, but try to get an appointment when you can. The second thing is, remember, the vaccine side effects or potential long-term complications are much less severe than anything as far as the potential that coronavirus and its illness will cause you. So definitely think of that the risk of the vaccine is much lower than the benefit of not getting the illness. Remember that always. And third thing, I recommend that everyone get vaccinated. I've heard patients tell me that another healthcare professional recommended that they not get the vaccine. And I don't quite understand that, because that is certainly not what medical professionals around the world are saying. We should all try to get the vaccine so we prevent the disease and not spread it to anyone else. Thank you for listening tonight. I hope everyone is safe. If you have any questions about the vaccines, certainly speak to your physician or someone who has some good knowledge about this. And hopefully I will see all of you in this room very soon.